Greetings, YouTube. I recently did a video about my improvement over time as far as my blood glucose levels were concerned. It was a health update, and it was very positive, and it was. And in fact, my blood glucose levels are still excellent. I checked my blood glucose levels half an hour ago, and they were 103, which is darn near perfect. 100 is the target. And 103 would be a perfect number for someone that isn't diabetic. So someone that is, good on me. But being diabetic is more than just that. And diabetes varies from person to person, so I'm not speaking universally. But for me, diabetes also means that my blood circulation doesn't work as well, that I can't heal as quickly, and I don't fight infections as well as I used to. It takes me much longer to get over colds and flus. Pardon me. In fact, I have no choice. I have to get the vaccine, flu vaccine every year, just as a defense mechanism, because when I don't, it's not pretty. I got it last year, and last year's batch was not well conceived, and I ended up missing work for like 6 days. It was not fun. It was the worst case of flu I've ever had. But I also suffer from neuropathy. Neuropathy is essentially my nerves in my feet are dead, and I can't feel most of my feet. Starting about mid-calf, am going down. As I starting mid-calf, I start to lose sensation, and the further and further you get down my foot, I lose more and more sensation to get to my toes, where essentially I have no sensation whatsoever. I have in fact pulled a damaged nail off my foot without even noticing it. Just didn't feel it. And last Wednesday, I checked my feet like I do every time I shower, and my toe had a heavy callus on it. My toe often has a heavy callus on it. I'd suffered from an ulcer on my toe about 4 or 5 years ago, and it never ceased to have a heavy callus. I file it back, and it grows back. You get the idea. Calluses do that. But sometime between Wednesday and Friday, because I didn't shower on Thursday, I got a blister, and it got infected. And so when I checked my foot Friday, I had a wound. And as soon as I noticed the wound, I immediately called my doctor, who was busy that day. So I went to one of her companions in another branch of the clinic. And it's just a GP, a guy who's, just a general practitioner. And I know he couldn't handle this. He just couldn't. He doesn't have the skill for it. But he got me the reference I needed to a wound care center here in my city. He also put me on Cephalexin, which is a type of antibiotic because I'm allergic to penicillin. And he got me a prescription for sulfadiazine cream, which is a wonderful product and really useful for healing wounds. I highly recommend it. You can actually get this over the counter in specialty places, like places that deal with medical issues. You can find this over the counter. I recommend keeping some of it around the house. It really is useful for healing wounds, even if you don't happen to have neuropathy. So I immediately hopped on the issue, got myself an appointment for Monday, this past Monday, which was 2 days ago, and I went to see my see a group of people who I'd seen when I had my last issue with my toe, and they looked at it and they said, "Yeah, it looked a little problematic," and he was correct. And he basically removed the skin off the toe so that the wound was completely exposed, taking the necrotic flesh and the callus with it all in one shot. So he essentially removed a piece of skin about that big off of the top of my toe, which is almost about half the surface area of my toe was removed. And I've decided that it helped people understand what this actually means. I'm going to include footage in this video of what my toe currently looks like. This is 2 days after the procedure was done, so it doesn't look horrible. It is just after a shower, so it is clean. It is just before I treated it with Silvadine and bounded it back up so it would stay safe until I take a shower next. Or at least till tomorrow morning when I get home and I change the bandage. Now I'm also wearing a stupid shoe, which is a big clunky Frankenstein style shoe, which has a large void under the toe, so that so that there's no pressure at all of the toe when I'm in the house or out and about. There's simply nothing under my toe. My toe has all the space around it it possibly needs, so there's nothing touching it except for the the bandage and the sock around it. I can't wear this at work, so I have a special insole in my boot I'm wearing. And if I need to, I actually have a customized boot which I can wear, which I kept from the last time I had an ulcer. So let me warn you, it is not pretty in the least. It looks like someone chewed on my toe and spit it out. That's the best way I can describe it. It isn't pleasant at all. It will never be pleasant. It's just there's no way around looking at an ulcer and have it be nice. It will eventually heal. It did last time, and it will we have to let it heal from the inside out. And eventually the skin will come over it, and I'll be fine. Hopefully I can figure out why the heck I got that blister, because I still haven't figured it out. It's kind of annoying. And hopefully if I can figure it out, I can avoid this in the future. But who knows? It may be something that I just have to end up suffering every few years, every 4 or 5 years, which is going to be more difficult because as time goes by and then I get older, I will heal more slowly as things progress, which will just make this more difficult. But this is why people who have diabetes sometimes lose limbs, because they can't heal. I'm doing my best to take care of myself, but sometimes it comes out of the blue, and it's frustrating because I did everything I could to make sure my feet stay healthy, and in a 2-day time period something just went bad and I don't know what. And there's no one in the world more frustrated about this than me. And but just deal with it and move forward. No use in beating myself up over it. The past is a book. We can learn from it, but we can never change it. So I'm just going to do it best I can, follow my doctor's instructions to the letter, and heal. So here's the footage, and again, be warned, it is graphic, it's not pleasant, and I hope that you can learn something from it, and as a bit of a cautionary tale, take care of yourself. If you're diabetic, pay attention to your extremities. You don't want to end up like this. So, cue the footage. This is unfortunately what an ulcerous toe looks like. Oops, sorry. Camera's kind of in the way, so I'll try to keep it down. And this actually looks a lot better than I thought it was going to. I apologize for the disturbing image, but I think people need to know that sometimes the side effects of diabetes are most decidedly not pretty.